previous one. So
October
is a better way.
So we have those who have already taken.
Okay. One question to Dr. Vipul bhai. We are getting so many patients just now having a severe throat pain, but congestion is not that much, and just like a flu-like symptoms. So in this case, what we should we start?
I don't know for the picture. I had a picture of severe throat, particularly those who are intense inflammation. If there is a mild inflammation, mild fever, you can definitely have some. You just ask the patient to have a daily form.
Because actually it is according to guideline, antivirals should be given at least within 2 days.
Yeah, exactly. Yeah. If you start antiviral drug within 48 hours, it is a better response and it is an excellent response. But from all this, see, if you look at the iceberg, tip of iceberg, the iceberg, every 10,000 population, 2,600 have a illness, particularly in season, that season. Now, out of the 2,600, only 10% are going into ICU. For this, all these patients don't require antiviral drug because there is again a problem. Patients take 3 days, 4 days drug, stop it, again resistance problem with which. So I think if WHO and the national guidelines, they are appropriate. Now you can ask second day I जो दिया इसमें लाए patient आवे परिवार में high grade fever था और severe throat you can start at that day also.
So in fact, Dr. Bipin rightly said that it is a contradictory statement. Start within 48 hours and at the same time wait for this. So probably the family physicians are best to treat ILI, where you can call next day and the guideline says worsening fever or worsening throat pain or worsening congestion, then you should start it on day 1, on day 2. So day 1 I would wait, on day 2 I would start, unless the patient falls into pregnancy, COPD, smoker or impaired lung function, liver function, immunocompromised. Day 1, one should start. But if the patient is healthy and the next day is worsening, then you should start on day 2. So that should be some compromise that can be done. I think one more thing that I wanted to tell before I go on to the next 6-8 slides, which would sum up these things, is because I would require confirmation from both the experts. Dengue is a non-catarrhal illness, and therefore any fever starting with sneezing, not dry coughing, but sneezing and rhinorrhea would generally not be dengue. Am I right or wrong? So if a fever starts with rhinorrhea or sneezing, then you should wait for a day or go for NS1. Just don't think, although there would be body ache, etc., it may not be dengue. Dengue generally does not start with sneezing and rhinorrhea. It can start with dry cough, but not with sneezing and rhinorrhea. We'll go to just coming off of this session. These are the important parameters which requires hospitalization in a patient of dengue: persistent vomiting, increasingly severe abdominal pain, tender hepatomegaly, a high or increasing hematocrit more than 20% from baseline, concurrent with a rapid decrease in platelet count, development of effusion or ascites or mucosal bleeding, and lethargy or restlessness. ઘણીવાર આપણે પૂછવાનું ભૂલી જઈએ છે બ્રશ કરતી વખતે બ્લીડ થયું કે નહીં. Always asking, because mucosal bleeding is more common. This is something that Dr. Bipin wanted to show. This is the rash in dengue. You can see this is rash in dengue. It is different from the petagy. This is undifferentiated macular or maculopapular rash that can occur on face, thorax, abdomen and extremities, and this is petagy. Right? You can see the difference. This is rash. This is generalized, a raised hour, while this is petagy, which is typical of dengue. Right? And this is the rash of chikungunya. Akku gulabi thai gayo. Akku sharir. This is rash of chikungunya. So as I said, all viral fevers are exanthemas, so don't get worried about the exanthemas. Hematocrit and pulse pressure I have already told. Keep an eye on it. Diastolic blood pressure is very, very significant in all these viral fevers. This slide has already been shown. So always remember, during fever NS1 IgG, and then once the fever subsides, IgM. This is a very important approach to plasma leakage. Just best slides આપણે જોઈશું. Monitor clinically oral fluid intake. Monitor vital signs every 2 to 3 hours, if not possible every 12 hours. Dengue na patient ને તમે સવાર સાંજ બોલાવો તો it is highly justified. Monitor hematocrit. Monitor urine output. પેશન્ટને સવારથી સાંજ સુધીમાં 6 વાર યુરિન થયું કે નહીં ઇન્વેરિયેબલી પૂછી લેવાનું. 6 times urine is a reasonable guide that urine output is fine. If it is so and oral intake is fine, then continue with the treatment. And then the last slide that we are going. This is dengue, high index of suspicion, frequent reassessment, large pool of primary dengue patients are at risk of DHF, serial CBC, IgM by ELISA only after 5th day. Comparing malaria species, I am skipping those slides. And then costly errors in management of severe malaria, we are missing hypoglycemia. Hypoglycemia can occur in malaria, hypoglycemia can occur because of chloroquine and quinine, and hypoglycemia can occur in a diabetic patient having malaria. So always think about it, and if the patient is diabetic on insulin, cut down the insulin doses at least by 10%. Very important in malaria. Misjudgment of severity, failure to diagnose associated complication, as very rightly said by people by gram-negative septicemia can later on occur. Delay in starting treatment, missed or late diagnosis. So take home message, use smear, QBC, RDT, cell counter for diagnosis. Say no to artemisinin monotherapy. Don't give monotherapy. Falsigo injection, although we should not use the treatment, commonly family physicians આપે છે. Then use some oral drug along with it. એકલું falsigo નહીં ચાલે. Right? So artemisinin monotherapy should not be giving. Always use ACT, that is compound with combination for falciparum malaria. Malaria vaccine is not inside. Say no to artemisinin monotherapy. And then last few things, try to learn pattern of fever when fever is there. Associated symptoms very important. Catheter or not, good discernment. Do not start NSAID. ક્યારે પહેલા દિવસે ભૂલમાં નિમેસેલાઇડ, કોમ્બીફ્લેમ, ડાઇક્લોફેનેક do not give. Do not start antimalarial without investigation. In metros or towns, it is crime not to go for investigation. Antimalarial symptom ચાલુ ના કરો. From where Dhirenvi started his presentation, be ready for hypoglycemia with chloroquine or with malaria itself. No antibiotics on day 1 unless you are very sure we have not taken pneumonia, but a pneumonia patient coming with yellow expectoration, high count, antibiotics are justified. Otherwise, there is no other illness where antibiotics are justified on day 1. In fact, as people very rightly said, it can prolong viremia. In endemic area, NS1 on day 1, જ્યારે dengue ચાલતું હોય, go for NS1 and IgG. Do not use a single anti-malaria alone. Again and again and again and again. એકલી chloroquine નહીં ચાલે, એકલી artemisinin નહીં ચાલે. All viral fevers are associated with exanthemas. બધામાં even mumps માં પણ થાય અને measles માં પણ થાય. So exanthemas are not the pathology. All exanthemas are not pathology. Platelet count is not an indication for hospitalization in a patient of dengue unless the patient is on aspirin or platelet count is significantly low or going down drastically. Always keep an eye on hemoglobin, HCG and pulse pressure. All viral fevers have altered liver enzymes but not more than 3 times upper limit of normal. So please do not use the word jaundice further. બિચારાનું બધું ખાવાનું બંધ થઈ જશે. Seriously, this is happening. 7 દિવસથી દૂધને અડ્યો નથી, ફલાણું નથી, દીકરો બિચારો ચણા શેરડી ખાય. So upper limit of normal is 3 times na that. So jaundice word please do not use. SCPT and SCOT are not marker of liver function. If at all you are worried about liver function in dengue, go for APTT, right? And it is important to teach prevention of disease for the self. આપણા પોતાના માટે, પેશન્ટના પોતાના માટે, ફેમિલી માટે and society માટે, all of them. Selection of mosquito repellent is very important. Do not give false reassurances about fever. 2 દિવસમાં ઉતરી જશે એવું ક્યારે ના કહો. All viral fevers persist for 5 days. રહે છે. So 2 દિવસનું તો promise આપો જ નહીં. And hydration is very, very important. I think that's where we'll close. Thanks everyone. Very, very important contribution for all 4 of our faculty. Thank you very much. Thank you.